I'm Dr. Peter, a board-certified urologist. What if I told you one of the most private things a man does is also one of the most misunderstood, especially as we get older? For over 3 decades, I've sat across from men in their 60 seconds, 70 seconds, and 80 seconds, and there's a silent conversation we end up having. It's about masturbation. They come to me frustrated and quietly wondering, is it still healthy? Is it safe at my age? Is it something to be ashamed of? Let me know in the comments below, what's the biggest myth you've ever heard on this topic? What if the beliefs you've held are flat out wrong? And what if this very act is critical for your heart, your prostate, and your overall health? If you're ready for honest, no-shame health advice, do me a favor and hit that like and subscribe button right now. In this video, I'm revealing the secrets about masturbation that older men wish they had learned decades ago. Let's get straight to it. Secret has shown. The prostate protector. You're ignoring. The first thing we need to talk about is your prostate. For decades, men have carried this quiet fear that sexual activity, especially as they get older, might somehow strain or damage this gland. The common thinking is that it's better to leave it alone, to not overdo it. But after 30 years of practice, I can tell you with full confidence, the problem isn't the activity, it's the time's inactivity. Think of your prostate like a system of pipes in a house nobody's living in. When water doesn't flow, sediment builds up, things get clogged, and pressure causes problems. Your prostate is always producing fluids. When those fluids have nowhere to go, they stagnate. This is called prostate congestion, and it can lead to inflammation and a constant, uncomfortable feeling of fullness. Now, here is the secret. Regular ejaculation is your body's natural way of flushing the system. It cleans out old cells and other junk that can build up. This isn't just my opinion. It's simple human biology, and it's backed by powerful research. A huge study out of Harvard followed almost 32,000 men for 18 years and found something remarkable. Men who ejaculated 21 or more times a month had around a 20% lower risk of getting prostate cancer compared to men who only did it 4 to 7 times. Let that sink in. The very act that many men feel shame or guilt about is one of the biggest things you can control to protect your prostate. It doesn't matter how it happens, with a partner or on your own. The benefit is in the release. The idea that you're protecting your prostate by doing nothing is the opposite of the truth. You protect it by keeping the system flowing. Secret #2. The use it or lose it principle is real. The second secret is a phrase you've probably heard before, but when it comes to your sexual health, it is profoundly true. Use it or you lose it. Let me tell you something. After more than 3 decades of listening to men, the number one complaint I hear isn't always about testosterone or libido. It's this: Doc, it's just not working like it used to. And 9 times out of 10, before we even look at prescriptions, I see a pattern of inactivity. They've just accepted that the machinery is shutting down. But what they don't realize is that function is tied directly to maintenance. Your erection is a hydraulic event. It's all about blood flow. Regular erections are like a workout for the tissues in your penis. They bring in fresh, oxygenated blood, which keeps the blood vessels flexible and healthy. When you stop all sexual activity, your body gets the message. This function isn't a priority anymore. It's not a punishment. It's just biology. The body starts deprioritizing blood flow to that area. The vessels can get narrower, less elastic. I've seen countless men who stopped masturbating for years, and when they wanted to be active again, their body just wouldn't respond. It wasn't a disease, it was just the consequence of disuse. The secret here is to understand that masturbation isn't just for a moment of pleasure. It's essential physical maintenance. It's about keeping the system online, respectfully and consistently, at 60, 70, and beyond. Secret #3. Your brain is getting a boost, not just your body. The third secret goes beyond your body and into your brain. For generations, men were taught that masturbation was something to feel guilty about at best, a purely mechanical act. This completely ignores the powerful chemistry happening inside your head. Every time you have an orgasm, your brain releases a cocktail of powerful neurochemicals: dopamine, serotonin, and oxytocin. Dopamine is for reward. Serotonin helps with mood. And oxytocin is the bonding hormone that brings a sense of calm. It's nature's built-in system for relieving stress and boosting your mood. As we get older, life can bring on more anxiety, loneliness, and trouble sleeping. What so many men wish they knew sooner is that masturbation can be a tool for taking care of your mental health. I've had patients, widowers in their 70s, tell me they felt lost in a fog of isolation. When they finally gave themselves permission to experience this again, they started sleeping better. They felt less on edge. They told me they just felt better about life. This isn't in their heads. The hormonal release directly fights cortisol, the body's main stress hormone. Lowering cortisol doesn't just make you feel calmer, it helps your immune system and your heart. So, the secret is to reframe it. It's not a sign you're lonely. It's an act of self-connection that builds your mental and emotional resilience. Secret #4. The line between a healthy habit and a harmful crutch. Now for the fourth secret. This one is a crucial distinction. It's the line between masturbation as a healthy, positive act and using it as a mindless crutch to escape your feelings. We've talked about the benefits, but there's a risk when the act becomes a way to numb yourself to boredom, sadness, or anxiety. When that happens, it stops being restorative. It just becomes a quick dopamine hit that can leave you feeling even more disconnected and alone afterward. I remember one of my patients, we'll call him Gerald, a 72-year-old who had just lost his wife. He told me he was masturbating several times a day, but not because he felt desire. He was trying to run from the pain of his loneliness. He wasn't feeling pleasure. He was just trying to feel less. He told me he felt emotionally flat, and the act was only making him feel more isolated. The secret here is one word: mindfulness. It's about asking yourself, why am I doing this right now? Is it to connect with my body and feel good? Or am I trying to run away from something? Healthy self-pleasure is intentional. Harmful use is escapism. It is a powerful tool, but it's not a replacement for human connection. Acknowledging your emotional needs and reaching out to friends, family, or a professional when you need to is just as important as taking care of your physical health. The myth of too much and the reality of too rough. The final secret tackles the one anxious question I hear more than any other. Doc, am I doing this too much? Men are haunted by these old myths that if they cross some imaginary line, they'll cause damage or run out of energy. Let me tell you something. After 30 years in this field, there is no magic number. What's right for one man isn't right for another. The real secret isn't about how oftentimes you do it. It's about how hard times you do it. The most common injuries I see from masturbation aren't from too much, they're from too rough. As men get older, sensitivity can sometimes decrease. A common and dangerous response is to compensate with a very tight, aggressive grip, what some call a death grip. This habit, over time, can cause real problems. It can cause skin irritation, but more importantly, It can desensitize the nerves, making it harder to feel pleasure from normal touch. In some serious cases, being too aggressive can even contribute to Peyronie's disease, where painful scar tissue builds up. The secret is simple. Listen to your body. This should feel good, not like a workout. Using a lubricant isn't a sign of weakness. It's a sign of intelligence. It protects your skin and can even make it feel better. So, forget the myths about frequency. The real key to doing this safely for the rest of your life is to be gentle. Prioritize comfort over force. Your body will thank you. So, let's recap these secrets that too many men learn far too late. First, we learned that regular ejaculation is one of the most powerful ways to protect your prostate and may even lower your cancer risk. Second, we established that use it or lose it is a biological reality for your erections, and masturbation is a key form of maintenance. Third, we uncovered the profound mental health benefits, how it can fight stress, boost your mood, and help you sleep. Fourth, we learned the critical difference between a healthy habit and a harmful crutch, emphasizing mindfulness. And finally, we threw out the fear of too much and replaced it with the wisdom of not too rough. Your sexuality doesn't have an expiration date. It changes, but it remains a vital part of who you are. You never need to feel shame for being alive in your own body. Now that you have this information, you're equipped to make choices that honor both your health and your dignity. I've made another video on the 7 foods that can wreck your prostate, which is a perfect next step on this journey. You can click on the screen to watch it now. And please, share your thoughts in the comments. Did any of these secrets surprise you? Your story matters, and it could help another man feel less alone. If this video helped you, please hit that like button. And don't forget to subscribe for more no-nonsense health advice that respects your intelligence.